Maglinte, and I am best criminology student. In this video, I'm going to explain all about first aid. So what is first aid? It is the provision of immediate care to a victim with an injury or illness, usually affected by a lay person and performed within a limited scale range. So there are three objectives of the first aid. First is to prevent further injury. Second, preserve life. And third, promote recovery. So the importance of first aids are providing quick medical treatment until professional assistance arrives, helps ensure that the right methods of administering medical assistance are provided. Knowledge on first aid also benefits the individuals themselves. It affords people to provide help during various emergency situations. There are four principles of emergency care: collect, examine, treat, and call. Collect the detailed history of accident either from victim or from anyone who has witnessed the accident. The victim's injury should be examined thoroughly, taking note of every symptom to know the correct diagnosis. With the help of a diagnosis, treat the victim until the doctor arrives or shift the victim to the hospital and aid the patient during transport. Call the doctors or shift the victim to the hospital as soon as possible so that the patient can be treated properly instead of prolonging the first aid. In doing first aid, there are golden rules to be followed. Number 1, do first things first quickly, quietly, and without fuss or panic. Number 2, give up artificial respirations when breathing has stopped. Number 3, stop any bleeding. Number 4, guard against or treat from shock by moving the casualty as little as possible and handling him gently. Number 5, do not attempt too much to the minimum that is essential to save life and prevent the condition from worsening. Number 6, reassures the casualty and those around and so help lessen anxiety. Number 7, do not allow people to browse around as fresh air is essential. Number 8, do not remove clothes unnecessarily. Number 9, arrange for the removal of the casualty to the care of a doctor or hospital soon as possible. In doing first aid, we should know bandaging. So bandaging is something you would do to control severe bleeding and protect against infection. We need to check for circulation in the casualty. Compare both hands to make sure they are similar in temperature and color. Check the hand to make sure it is not swelling or turning blue. Ask the person if the hand feels numb or tingling. If they lose sensation, then it's too tight. Do not remove the bandage but loosen it a bit. If the first dressing becomes soaked with blood, then simply put another one on top. Do not remove the original one as you will be reopening the wound. Note: always use caution when dealing with bodily fluids. Wear gloves and wash your hands immediately after. Keep in mind that the injured person may go into shock. So what is the purpose of bandaging? So why we apply the bandage method? First, to secure dressing in position. Second, to form slings or support. Third, to secure pads. The roller bandage is most commonly used type of bandaging. These bandages are made of cotton, gauze, crepe, elastic fabric or linen that are wrapped around the injured in spiral turns figure of 8. To improvise, material may be torn into strips of the required length and width. The width required for finger is 2.5 cm, for head and arms 6 cm, for the leg about 9 cm, for the body is 15 cm. The bandages should be tightly and evenly rolled. These are the rules for applying roller bandages. Face the casualty, except for bandages the head or back of the neck. When bandaging the left limb, hold the roll of bandage in the right hand and vice versa. Apply the outer side of the bandage to the part and unroll no more than 5 cm at a time. To bandage a limb, work from below upwards and from inside towards the outside over the front of the limb. See that the bandage is neither too tight nor too loose. Each layer should cover 2/3 of the previous layer of bandage. Finish in front, not over the wound, and fix the end with a safety pin, sticking plaster, stitching, or by tearing the end into two tails and tying. The completed bandage should be comfortable, look neat, and fulfill its purpose with no restriction of circulation. So what are the patterns used in bandaging? Circular turns are used for head and trunk. Simple spiral for parts of uniform thickness, example, fingers and wrist. Reverse spiral used on limbs where the thickness of the part varies, example, for arm and leg. Figure of 8, this may be used on limbs instead of reverse spiral, also for the hand and foot spica. Used for the shoulder, hip, and thumb. Divergent spica for a flex joint, example, elbow, knee, or heel. Recurrent to cover tips of finger or a stump. Special bandages such as capelin for the head, eye bandage, ear, and breast bandages. And there are 5 types of bandages. First, triangular bandages. Second, bandage for the scalp. Third, collar and cuff sling. Fourth, triangular sling. And fifth, improvised slings. The following are the categories of injuries and the corresponding first aid needed: cuts, bites and bruises, broken bones or fractures, asphyxia, burns, and other serious injuries. If the casualty had cuts and wounds, these are the things that you must do. First, stop the bleeding. Second, clean cut or wound. And third, protect the wound. So when to call a doctor? The wound is deep or the edges are jagged or gaping open. The wound is on the person's face. The wound has dirt or debris that won't come out. The wound shows signs of infection such as redness, tenderness, or a thick discharge, or if the person runs a fever. The area around the wound feels numb. Red streaks from around the wound. The wound is a result of an animal or human bite. The person has a puncture wound or deep cut and hasn't had a tetanus shot in the past 5 years, or anyone who hasn't had a tetanus shot in the past 10 years. And if the person had bitten by an animal, these are the things you must do. Wash the wound thoroughly with soap and water. Apply an antibiotic cream or ointment and cover the bite with a clean bandage. Seek prompt medical care if the wound is a deep puncture or you're not sure how serious it is. The skin is badly torn, crushed, or bleeding significantly. First, apply pressure with a bandage or clean cloth to stop the bleeding. You notice increasing swelling, redness, pain, or oozing, which are warning signs of infection. You have questions about your risk of rabies or about rabies prevention. If the bite was caused by a wild animal, seek advice from your doctor about which animals are most likely to carry rabies. And if the person had the bruises, rest the bruised area if possible. Ice the bruise with an ice pack wrapped in a towel. Leave it in place for 10 to 20 minutes. Repeat several times, a day for a day or 2 or as needed. Compress the bruised area if it is swelling using an elastic bandage. Don't make it too tight. Elevate the injured area. Consult the doctor if notice very painful swelling in the bruised area. Are still experiencing pain 3 days after a seemingly minor injury. Have frequent, large or painful bruises, particularly if bruises appear on your trunk, back or face, or seem to develop for no known reasons. Have easy bruising and a history of a significant bleeding, such as during surgical procedure. Notice a lump or hematoma from over the bruise. Are experiencing abnormal bleeding elsewhere, such as from your nose or gums. Suddenly begin bruising, but have no history of bruising. Have a family history of easy bruising or bleeding. Broken bones or fractures. If the broken bone is the result of a major trauma or injury, call 911 or your local emergency number. Take these actions immediately while waiting for medical help. Stop any bleeding, immobilize the injured area, apply ice packs to limit swelling and help relieve pain. Treat for shock if the person feels faint or is breathing in short. Rapid breaths. Place the person down with the head slightly lower than the trunk and if possible, elevate the legs. Cramps and sprain. Use a warm towel or heating pad on tense or tight muscles. Take a warm bath or directing the stream of a hot shower onto the cramped muscles. Massage the cramped muscle with ice. Elevate the injured limb. In asphyxia, there are 3 categories: suffocation, strangulations, and drowning. In suffocations, perform abdominal thrust. Stand behind the person, make a fist with one hand, grasp the fist and with the other hand. Perform between 6 and 10 abdominal thrusts. To perform abdominal thrust to yourself, place a fist slightly above your navel. Grasp your fist with the other hand and bend over a hard surface. Show your fist inward and upward. And for pregnant women, position your hand a little bit higher at the base of the breastbone. Then, proceed to the abdominal thrust. Repeat until the airway is okay. For unconscious person, lower the person on his or her back on the floor. Clear the airway. Begin CPR. For choking infant younger than age 1, assume a seated position and hold the infant face down on your forearm. Support the infant's head and neck with your hand and place the head lower than the trunk. Trump the infant gently but firmly 5 times on the middle of the back using the heel of hand. Turn the infant face up on your forearm, resting on your thigh with the head lower than the trunk if the infant is still breathing. Repeat the back blows and chest if breathing doesn't resume. Begin infant CPR. And in strangulation, immediately remove any constriction from around the casualty's neck. Support the body while you do so if it is still hanging. Do not move the casualty unnecessarily in case of spinal injury. Do not destroy or interfere with any material such as nut rope that police may need as evidence. Lay the casualty on the floor. Open the airway and check breathing. If she is not breathing, be prepared to resuscitate. If she is breathing, place her in the recovery position. And finally, call an ambulance. And if the person's drowning, get help, move the person out of the water, check for breathing, look to see if the person's chest is moving. If the person is not breathing, check pulse. If there is no pulse, start CPR. Burns. There are 2 types of burns, minor burns and major burns. In minor burns, cool the burn under running water or apply a cool, wet compress until the pain eases. Remove rings or other tight items from the burned area. Don't break blisters. Apply lotions, bandage the burn. If needed, take an over-the-counter pain reliever. In major burns, until emergency help arrives, protect the burned person from further harm. Make certain that the person burned is breathing. Remove jewelry, belts, and other restricted items, especially from around the burns areas on the neck. Cover the area of the burns. Don't immerse large severe burns in water. Elevate the burn area and watch for signs of shocks. The following are the other serious injuries: hemorrhage or internal bleeding, splints, heart attack, injuries to the soft tissue, spinal injuries, concussion, seizures, stroke, angina, cardiopulmonary resuscitations, ingested poison, breathed inhaled poison, foreign bodies on different parts of the body. And please remember, if serious injuries happens, be sure to stay calm and call 911 or your local emergency number. That's all. Thank you.